Did you know that nearly 1 in 3 seniors experience a serious travel-related mishap while abroad, from medical emergencies to getting scammed or injured? If you're over 70 or traveling with someone who is, this video could be the most important thing you watch before your next trip. Today, we're diving into 11 hidden dangers of traveling after 70 that most seniors don't see coming, and more importantly, how to avoid them. Whether you're planning a bucket list cruise or a quiet family visit overseas, being informed can mean the difference between a dream vacation and a disaster. Number 1. Overexertion and travel fatigue. Traveling is exciting at any age, but packing too much into each day can backfire for those 70 plus. It's easy to overestimate your stamina and try to tour from dawn to dusk. The hidden danger is that chronic stress and fatigue can actually weaken an older person's immune system, making you more susceptible to illness on your trip. Pushing your body too hard, long walking tours, heavy luggage, or little sleep might lead to exhaustion or even falls. One travel health study notes that even a modest improvement in strength and endurance reduces the likelihood of injury for older travelers. In real life, seniors who overschedule often end up needing vacation days to recover from their vacation. To stay safe, build in rest breaks and listen to your body. Balancing activity with downtime isn't laziness. It's a smart way to keep your dream trip from turning into a health setback. Number 2. Mobility and accessibility challenges. Many seniors don't anticipate how much mobility issues can complicate travel. Cobblestone streets, endless airport corridors, or hotels without elevators can quickly turn hazardous. Historical sites and off-the-beaten-path lodgings often aren't updated for accessibility, meaning uneven steps and lack of handrails that increase fall risk. Falls are not a minor concern. 1 in 4 Americans over 65 experiences a fall each year, and falls are the leading cause of injury for older adults. Real-world scenarios abound of seniors struggling with steep museum staircases or slippery showers abroad. A simple stumble on an unfamiliar sidewalk could result in a broken hip far from home. The danger lies in assuming everywhere will accommodate your needs. Always inquire ahead about elevators, ground floor rooms, or wheelchair access. By planning for your mobility using canes, walkers, or requesting airport assistance, you can avoid turning a dream destination into an injury site. Number 3. Travel insurance gaps and the Medicare myth. One big hidden risk for seniors traveling abroad is assuming your regular health insurance or Medicare has you covered. In fact, original Medicare and Medicaid do not pay for medical care outside the United States. Many older travelers don't realize this until faced with a foreign hospital bill that can skyrocket. The U.S. State Department bluntly warns to buy travel health insurance because government programs won't cover overseas emergencies. Imagine needing surgery or an air ambulance evacuation in another country. Costs can exceed $100,000, and without proper insurance, you'd pay out of pocket. Unfortunately, countless seniors have learned too late that their insurance back home was useless abroad. The hidden danger is a coverage gap that could wipe out your savings. Experts strongly recommend seniors get travel medical and evacuation insurance before a big trip. It's a small expense for peace of mind that if something goes wrong, you won't be on the hook financially. Number 4. Limited medical access in distant locations. When adventure calls, it's easy to forget that not every destination has a modern clinic around the corner. If you have a medical emergency in a remote village or developing country, immediate care might be hours away. Travelers usually must pay for treatment up front at foreign hospitals, and quality of care can vary greatly. For seniors with chronic conditions, heart issues, diabetes, and so on, this is a serious hidden danger. A minor chest pain or high fever could turn life-threatening if local facilities are lacking. There are real examples. A traveler in rural Asia with a severe eye infection had to be airlifted to a better hospital in another country because nearby clinics couldn't treat him. Older travelers should plan for these contingencies. Carry a list of hospitals at your destination and know the local emergency numbers. Enrolling in the State Department's STEP program is wise. The key is recognizing that medical help might not be readily available. A sobering thought, but one that should spur smart preparation. Number 5. Deep vein thrombosis on long flights. Extended travel can be more than just tiring for seniors, it can be risky to your health. Sitting still on long flights or bus rides can lead to deep vein thrombosis, a blood clot in the leg. Part of the clot can break off and cause a deadly lung embolism. While DVT can affect any traveler, older age is a known risk factor. In fact, the reduced circulation from being immobile in cramped seats is sometimes dubbed economy class syndrome. Medical research shows air travel causes about a 3-fold increase in clot risk, and advanced age further raises the chances. Most seniors don't see this danger coming. Blood clots can form with no symptoms until sudden chest pain or breathlessness strikes. The good news is there are precautions. Wear compression socks, stay hydrated, and stand up or stretch your legs every couple of hours. If you have risk factors like prior clots or varicose veins, talk to your doctor before traveling. A little awareness goes a long way. Understanding DVT risk can literally be life-saving on that next international flight. Number 6. Illness and infections hitting harder. New environments expose travelers to all sorts of germs, and for older globetrotters, the outcomes can be more severe. Enclosed travel settings like cruise ships or tour buses are notorious for spreading viruses. The CDC notes that cruise ships often see outbreaks of norovirus and respiratory illnesses like flu and COVID-19. What might be a mild inconvenience for a younger tourist can land a senior in the hospital. Aging immune systems are less efficient, and chronic conditions can worsen any infection. That's why health officials urge older adults to be up to date on routine vaccines such as the flu shot, pneumococcal vaccine, and shingles vaccine before traveling. Food and water can pose dangers too. Travelers' diarrhea can quickly dehydrate anyone. Dehydration is especially dangerous for older adults, sometimes leading to organ failure or shock. Real-life case reports show seniors are often among the fatalities in travel-related illness outbreaks. The hidden danger is assuming you won't get sick abroad. Precautions like frequent hand washing, only eating well-cooked foods, and packing basic medicines or antibiotics if recommended by a doctor can make all the difference. Don't let a preventable infection turn your trip into a medical nightmare. Number 7. Scams and fraud targeting seniors. In foreign places, friendly faces aren't always what they seem. Unfortunately, older travelers are often prime targets for scams, theft, and fraud. Con artists assume seniors are carrying cash or are less tech-savvy, and they pounce on that opportunity. There's a darker side to tourism scammers aimed to take seniors' money and ruin their vacation. You might encounter fake taxi drivers who wildly overcharge or take you to the wrong hotel on purpose, friendly locals offering a free gift only to demand payment, or crooks who stage a distraction, like spilling something on you, to pickpocket your wallet. U.S. officials warn that numerous scams exist in popular destinations, and tourists should be vigilant. A retiree from Ohio, for example, might not anticipate that the helpful stranger at the ATM is actually memorizing their PIN. The danger here is naivety, letting your guard down in vacation mode. Protect yourself by researching common scams at your destination. Keep valuables secured and be skeptical of deals that are too good to be true. Staying cautious doesn't ruin the fun. It ensures some thief doesn't ruin it for you. Number 8. Sudden weather changes and climate extremes. A pleasant trip can turn perilous if you encounter extreme weather unprepared. Older bodies don't handle heat as well. They may not sweat efficiently or feel thirst until dehydration sets in. Statistics show that older adults are among the most vulnerable when temperatures soar. In the catastrophic Pacific Northwest heat wave of 2021, most victims were older adults, with an average age of 70, and over 80% of U.S. heat-related deaths annually are people above 60. That's a chilling, or rather heating, reminder of how dangerous high temperatures can be. On the flip side, cold weather and sudden chills can lead to hypothermia in seniors who aren't dressed warmly enough, since circulation issues often increase with age. The key is to monitor the forecast and prepare accordingly. Pack appropriate clothing, stay hydrated, schedule strenuous activities for cooler parts of the day, and avoid travel during known hazardous seasons like hurricane season when possible. Number 9. Road accidents and transportation hazards. Traffic patterns, road safety laws, and driving habits vary wildly around the world. If you're not used to zipping through Rome in a tiny taxi or navigating winding mountain roads in a tour bus, you could be at risk. Shockingly, about 1/3 of injury-related deaths of U.S. citizens abroad are due to traffic accidents. That includes pedestrians being hit, bus and car crashes, or even scooter accidents. Older travelers may be less able to react quickly or withstand the physical trauma of a crash. Something as simple as stepping off a curb in a country where vehicles drive on the opposite side can lead to confusion and danger. Public transportation can have its pitfalls too. Overcrowded trains, boats without enough life vests, or vehicles without seatbelts. The hidden danger is assuming travel is as safe as back home. Always wear seatbelts when available and sit in reputable taxis or buses. If you rent a car, understand local road rules and avoid driving at night in unfamiliar places. Crossing streets demands extra vigilance. Don't expect drivers to stop for you. Number 10. Cognitive overload and getting disoriented. For older adults, especially those with even mild cognitive impairment or memory issues, this can pose a hidden danger of disorientation. It's easier than you think to get lost in an unfamiliar city or become separated from your group. Tragically, there have been cases of seniors with conditions like early dementia wandering off during trips. In one recent incident, a 75-year-old tourist with Alzheimer's disease wandered away from his family at a scenic stop in Spain and went missing overnight. He was found exhausted but alive, a lucky outcome, as others have not been so fortunate. Even without dementia, travel's sensory overload can confuse anyone. Unfamiliar metro systems, similar-looking hotel hallways, or jet lag can cloud thinking. The danger is underestimating how vulnerable one can be if they become confused abroad. To mitigate this, seniors should always carry hotel contact info and a phone with important numbers. Traveling with a companion or tour group is wise if you sometimes get turned around. Don't be shy about asking for help if you feel disoriented. Most people are kind if they see an older person looking lost. By acknowledging this risk, you can take simple steps like writing down directions or using GPS tracking apps to ensure that a moment of confusion doesn't turn into a panicked or dangerous situation. Number 11. Medication mishaps and health maintenance. Travel can throw a wrench into your medication routine in unexpected ways. Crossing time zones can confuse dosing schedules. Doctors advise discussing adjustments before you go to avoid missed or double doses. There's also the risk of losing or running out of your meds abroad. Luggage can get lost, or customs might confiscate pills not in their original bottles. In some countries, your specific medication, or even a common U.S. over-the-counter drug, might be illegal or unavailable without a local prescription. The hidden danger is being caught without essential medicine. To illustrate, imagine a diabetic senior who can't replace lost insulin during a trip, a true medical emergency. Experts urge older travelers to pack an ample supply of medications in carry-on bags, keep them in original labeled containers, and carry a note from your doctor for any injectables. By planning ahead, you can prevent a vacation from being derailed by a medication mishap.